Hey there, it's Dr. Lori Polacek, and I'm checking in and making sure that everybody is feeling well and that their family's healthy, and that everybody is uh, practicing proper social distancing. Um, I know that in Rhode Island, it is now recommended that we wear masks out in public. So, since many of you know that I spent a lot of time in the operating room wearing masks, I thought I would give you a few helpful tips. Um, First of all, I do think during this time of stress and the fact that our schedules are definitely not of the norm, that it is important to continue your regular skincare regimen. Um, and I think that if you are going to be wearing a mask, it's equally as important, but it should be done about 20 to 30 minutes probably before you're going to put the mask on. You do want those products to absorb and not end up wasting them, having them get on the mask. Um, Once that's done and you're ready to put your mask on, I think things to think about are that you don't want to put on excessive makeup. When I was operating, I would arrive in the hospital with a light layer of makeup on, nothing too heavy, just enough to be presentable. And you know, it's important because otherwise it will get on the mask itself. You're wasting makeup. And also, it does get kind of warm under these masks as you continue to wear them. Um, I think if you want to look, you know, if you want to feel better about yourself, I think that putting eye makeup on is appropriate because that's what people are going to be focused on when they look at your face. Is what do your eyes look like? So typically, if you wear mascara, eyeliner, eyeshadow, that will make you feel better. In terms of putting the mask on itself, whether you have a cloth mask or you have a medical mask, I have the one that I've been wearing the past week, and I've been wearing the same mask because this isn't about things being sterile like in the OR where we would typically change our mask every time we see a new patient. This is protecting yourself and the people around you. So it is important to wash your hands before you put the mask on. You then really want to just touch the ear loops or the part that you're going to tie behind your head. The first time you put your mask on, you do want to secure it so that you know it fits properly and you don't have to keep adjusting it. So for instance, if I'm putting this mask on, I put it on with the loops. I secure it over my nose, and then while I'm in the store or out in public, I don't want to touch it at all. The whole goal is not to touch your face. So if you're picking up groceries and you're touching them, and then you're constantly, you know, readjusting your mask or pulling it down or pulling it up, it defeats the whole purpose. So you really want to try not to touch the mask or your face while you're out. Then what happens is you really should wash your hands before you take the mask off because now you've been touching things. And you want to try to take them off from whatever you're attaching the mask to. So whether it's, you know, the earlobes or ties that you have behind your head. And then you want to take the mask, and since I am reusing my mask, I'm trying to minimize how much I use. I'm hanging it somewhere so it's out of the way. I don't want family members to touch it. I certainly, if I had children, I wouldn't want them to touch it. And I wash my hands again after I take the mask off. And usually I've been in the store, so I want to make sure that I do it for that reason as well. So hopefully this has helped a little bit. Just remember, our office is closed for seeing patients, but we are manning the phones. Andrea is there every day during the week. She can answer any questions. She can reschedule your appointment, which we're doing as our time off kind of progresses. Our goal is to get back to work and to treating our patients and making everybody feel well as soon